Gluteal tendinopathy is inflammation or irritation to the tendons that attach to the greater trochanter of the lateral hip. Such tendons include the quadratus femoris, obturator internus, superior gemellus, piriformis, gluteus minimus, and gluteus medius. There are two common theories for how tendinopathy of the gluteus tendons develop, one being prolonged and over time, where the capacity of these tendons is not great enough to exceed the demands placed upon it. The second theory for mechanism of injury for gluteal tendinopathy is more an acute injury, where you might have a tearing or partial tear of one of these tendons, or two, a compressive incident where maybe you're spending a lot of time lying on one of these tendons and it is causing irritation to this area. It is important to note that the most prevalent population with gluteal tendinopathy is perimenopausal women and sometimes postpartum women. The theory is that the hormones may cause some issue at the tendons where pain is more likely. Treatment of gluteal tendinopathy is similar to other tendinopathies in that we are trying to increase the tendon's capacity to handle stress. In the beginning stages of gluteal tendinopathy rehab, we're trying to avoid compressive forces to these tendons, for instance, lying down on this hip or adducting, moving that leg inward to where you're actually creating compressive forces on the tendon on the bone of the greater trochanter. From there, we're making sure we have good mobility of the hip and low back, which may be contributing to some compressive forces of these tendons. And then we're essentially building these tendons' capacity through strengthening exercises. The external rotators of the hip, internal rotators of the hip, gluteus medius and gluteus minimus, which play a prominent role in stability of that hip. And then we're also looking at the front of the leg, including the quads, obliques, abdominal muscles, everything that's going to be playing a role in the stability of that hip. Progressive exercise selection, starting with isometrics or low-level concentric or eccentric exercises are appropriate, and then progressing to more challenging resisted exercises are a great way to build the capacity of these tendons. Less research has been done on gluteal tendinopathy compared to the Achilles and patellar tendinopathy. However, in order to increase the tendon's thickness or health of that tendon, heavy, slow, resistive exercises are the prominent. Thank you for watching my video briefly describing gluteal tendinopathy. If you have questions or you'd like free resources, please visit the link in my bio, which also has links to one-on-one online training or self-guided programs.